We are conducting regular sessions every day from 7 to 8, the Hindi session, 8 to 9 international session in English, and 9 to 10 local language session in Malayalam. Today, we have a guest in Dr. Manish Azad Singh, who has completed his MD and was an assistant professor in some colleges. And he is a person whose life is fully dedicated to homeopathy and is working hard to win, to uplift homeopathy among the public as well as among the people who are dedicated to homeopathy. And he is a person who is working very hard to win back patients who can be cured with our homeopathic single remedy. And he is an assistant physician working as an assistant physician in Divine Homeopathy Clinic, Varanasi. And this clinic is a well-established clinic, and it has been there for 33 years. And it's a great experience for him in working there. And he has done a lot of work during his MD as well as in COVID sessions, COVID period. He helped many patients in managing OPD cases, and he has worked in many professions. He has a very good communicative skill, is a very good computer basis management. All those things he has the ability to teach not only in public but also to the doctors. And here in this international forum, he has presented so many sessions in Hindi as well as English, and he has published 15 scholarly articles and well known in magazines both in English and Hindi. This is on Kent repertory, and Tina Corpus best among them have completed his internship or thesis on Tina Corpus and MD thesis on Kent repertory with the significant sample size, and selected STSS research on breast cancer. His research on breast cancer and its miasm was selected by CCRH STSH program. What as a data collector for KAB survey, what as a data collector for knowledge, attitude, behavior survey regarding, and he took regular lectures and repertory up to 3 to 4 times a week with presentations. And so this is all about Dr. Manish, and he is one of the best moderators among our IFPH team, and he's doing great service thereby to promote homeopathy through our forum also. And today, Dr. Manish will be discussing about role of homeopathy in antisocial personality disorder. This is something great because homeopathy can do such wonders in such cases. So last time also he presented in a different subject. So let us welcome Dr. Manish Azad Singh to this session. Welcome, Doctor.
Thank you, sir. Thank you very much. And thank you, IFPH, for calling me again and in this English session. So thank you all. Sir, can you please make me the co-host? I just left for a second and that's why I have been removed. Is my screen visible to everyone?
Yes, it's visible.
Thank you, sir. So firstly, before understanding antisocial personality disorder, let's talk about what is personality disorder. Firstly, let's have a basic understanding of personality disorder. Each and every time when I come here, firstly, I explain a slide on what is personality disorder and how can we understand the basic of personality disorder. So let's understand the basics first. Personality disorder is basically a diverse group of disorder in which the common thing is the lifelong pattern of unusual behavior. Okay. So if a person is behaving unusually for a day or for a month, then it is not a personality disorder. But if he or she is behaving like that for a year or for a few years, or have been behaving like that from several years, then that can be considered as personality disorder. So the basic difference is unusual behavior shown in a lifelong pattern or few consecutive years. Okay. These disorders do not show bizarre symptoms like mania or schizophrenia. Okay. So, or bipolar disorder, for instance. So, antisocial personality disorder or any personality disorder, for instance, shows a few mild behavioral symptoms which we have to notice or which we have to perceive, and then we have to treat as per the same. These disorders are observed in the way they cope their life's problem and relate to others, which may be considered troublesome, strange, or perhaps tiresome to others. So the behavior or the change which they show is can be perceived as per their behavioral trait. Uh, they do something differently. वो कहते हैं हिंदी में that they do something differently. Okay. We all require attention of our loved ones in our whole life. We do things, we do certain things for getting that love. Okay. And everyone among us wants to look good, wants to have a good physique, wants to look attractive, wants to dress well. Okay. So there is nothing wrong in it. Okay. But the behavior, if you started behaving unusually for getting that love or for getting that attraction, then that could be antisocial or that could be personality disorder. Okay. So for here, personality disorder, that if you are behaving unusually for getting that attention or you are behaving unusually for getting that love, then that could be personality disorder. Now, let's come to antisocial personality disorder. So firstly, the people who have taken the few classes I have given on the platform of IFPH, they would be knowing this. I always use a movie for explaining that what a personality disorder looks like. Okay. So many of the people who are attending here, there are 37 participants, leaving me there with 36. So many people watching me has watched the movie Kick. Okay. In this movie, Salman Khan, the male protagonist, does not want it to be bound in shackles of occupation or commitment. The person here, the main hero, the lead protagonist here, do not want to do any job. Okay. He always wants to he always wants to get that kick. Okay. So the name title is Kick. He had a serious problem with the norms of society. He do not wants to follow the rules and the norms and the regulation of the society. He loves to rob the money just for fun. And later he distributes that money in the poor people just for fun. Okay. He wanted to become a hero. And now when when his mother described him, then she says that he's a spoiled brat due to his father. He was a topper of the batch and in topper in 10th, topper in 12th, topper in civil engineering. And then he left the job of 50,000 per month just because he was not getting the kick. If someone has seen this film, he would be knowing that this guy is moving bicycles in the reverse direction on the terrace. Then he wants to come down with the pipe, and this is all when we and when once he gets married, then everything will get fine. Okay, this person will get fine if he got married. So the rest we all know. Okay, so the basic thing is, if a person is behaving antisocially, the first norm is Indian society says that he's a guy, he can behave like this recklessly, and if he will get married, then he'll get fine. Okay, and that is another debate. But by this example, I want to explain that antisocial personality disorder looks like this only. Okay, getting to the next slide, we are discussing the movie here because it is said that movies are mirrors of society. Okay, we all have seen people who have tantrum problems or they prove to become a failure in their life academically, socially, and they start behaving rebelliously. And when then the family started to saying that if they got married, then everything will get fine. If they get bound with a child, then everything will get fine. Okay, so is getting married is specifically a solution? Is getting married is a problem for every antisocial person around us? Is antisocial personality disorder is just an alpha male complex, just a rebellious attitude? So these slides will focus on this topic only, and we'll understand antisocial personality disorder with the help of this example only in further detail by the help of upcoming slides. So now let's understand what is antisocial personality disorder. Antisocial personality disorder is basically a defined pattern. It is a pattern of unusual behavior. Lifelong, you can see that it can be diagnosed with the help of socially irresponsible behavior, exploitative behavior, and guiltless behavior. Okay. A person who is behaving socially irresponsible, that means he do not wants to follow any kind of norm, any kind of rules or regulation which the society has made. They want to behave exploitatively, means they can take benefit of each and everyone in their life, and they have this guiltless behavior in their life. They always behave guiltlessly. If they hurt someone, they do not feel guilt. If they take something from someone, they do not feel guilt. So the three basic of understanding of antisocial personality disorder would be socially responsible, exploitative, and guiltless behavior. It is a deeply ingrained and rigid dysfunctional thought process that focuses on social responsibility with exploitative, delinquent, criminal behavior with no remorse. So what we have to remember from this slide is there would be no remorse. If a person comes to or walks into your clinics and behaves or talks that I hit that dog or I killed that cat and I don't have any guilt, then this should come into mind that this person could be antisocial. Now, if we get on the diagnosis part, the Diagnostic and Statistic Manual of Mental Disorder, DSM-5, as we all know it, classifies all 10 personality disorders in basic three clusters. Okay. So DSM-5, what it basically does, it is a diagnostic criteria which classifies each and every personality disorder into few clusters. Okay. So there are three clusters, clusters A, B, and C. Antisocial personality disorder falls into cluster B. Okay. It's a cluster B disorder. Cluster B disorders, whatever I have taken the classes from before, that also are from cluster B only. Okay. So histrionic personality disorder, narcissistic personality disorder, a borderline personality disorder, this all is cluster B personality disorder. Okay. So all these disorders will always have a presence with dramatic, emotional, or unpredictable interactions with others. Antisocial personality disorder is the only personality disorder among the other three, histrionic, narcissistic, and behavioral, that is not diagnosable in childhood. So if a person who is less than age of 18, if he comes to you and if he has been diagnosed with conduct disorder is not behaving properly, then you cannot diagnose him with antisocial personality disorder. You will only diagnose him with conduct disorder. You will say that after 18 we will see the rest, that whether he outgrows with antisocial or he just remains in conduct disorder. Okay, so you cannot diagnose a person less than 18 years with antisocial personality disorder. Now there is some etiology that why antisocial personality disorder comes into people, okay, or why people behave as such. So although as previous, there is no precise etiology known. So we firstly go with the genetic and then environmental factors. Okay, that there are some environmental factors which play critical role in developing of antisocial personality disorder. There are some environmental factors that correlate to the development as adverse childhood experience. Okay, so each and every psychological disorder, may it be bipolar, may it be schizophrenia, or some other personality disorder, they always come with some adverse childhood experience. Okay, so antisocial is also one among them. It could be appearing with some physical or sexual abuse in the history, or some neglect or some trauma which a child has taken during its growth. And along with the childhood psychopathology, so there could be CD or conduct disorder or ADHD, attention deficit hyperactive disorder. Okay, this could also be attended in the history. Some common factors observed in the patient with antisocial personality disorder. Some history, if we take, then this is experience of victimization. There was a time when this person who is behaving right now as Salman Khan was a experience of victimization in his childhood. Okay, so there could be physical abuse in his history, some emotional abuse, some sexual abuse, some parental negligence, or being bullied. Okay, being bullied is also a serious. It's also produces a significant psychosocial impact on a child. Okay, then there could be possible emotional or behavioral problems. Okay, so the person who is right now behaving as a bully could have been a history of being bullied. Okay, people would have taunted him for his career or for his walking behavior or for his coming down on a pipe. Obviously, if you are taking the example of kick, then being expelled or suspended from school, if we see that there would be a history of behaving antisocially when this person would have been expelled or would have been suspended from school for not behaving morally or for breaking the rules continuously. Okay. Running away from home, self-harm, these kinds of behavior are a trait which can be seen in a person who is behaving antisocially. There could be some brain damaging incidents also, as an exposure to alcohol in womb. If some people who are addicted to alcohol, they get conceived and the child is in womb and they are continuously taking alcohol, then that could also lead to this. Early exposure to lead or a traumatic brain injury can also lead to antisocial personality disorder. Now let's talk about epidemiology. Why we are discussing it here? Okay. So firstly, let's understand what is the population prevalence. It is 1 to 6%. It is 1 to 6% of the total population. 1 to 6% of the total population suffers from this disease. Okay. So now listening to it, 1 to 6% looks like a bit less. Okay. But if we think that we are 1 million, then understand this, that 1 to 6% is a bigger number. If we go through the gender distribution, then males are always 3 to 5 times more likelihood of being diagnosed with ASPD than females. Okay. So males are more diagnosed with it than females. As per example, if we remember the old classes, then histrionic personality disorder or narcissistic personality disorder are more diagnosed in females than in comparison to male. Okay. But antisocial personality disorder are 3 to 5 times more diagnosed in males in comparison to females. It's always substance abuse. So substance abuse has always found a significant correlation with antisocial personality disorder. Okay. Education and intelligence is always inversely proportional. Okay. So that is why people always tend to promote education. They always tend to promote intelligence, that do know that what is a certain way to behave in society, what is a certain way to talk, what is a certain way to conduct yourself. Okay. So education and intelligence or higher IQ is always inversely proportional to antisocial personality disorder. Now let's discuss about some sign and symptoms. If we are seeing an antisocial personality disorder person, then what are the few sign and symptoms which can be seen in that patient? Firstly, as we have discussed in the definition, disregard and violation for others' rights. So a person suffering from antisocial personality disorder has no love for others, or do not think or do not hesitate even a bit that I have disregarded someone's right or I have violated some other person's right. Okay. So a person suffering from personality disorder will never think about any other person's right or any other person's regards. Okay. Some symptoms other than that is failure to conform to the law. Okay. So he will not follow the law. Inability to sustain consistent employment. As we all know, since he do not wants to be bound into any shackles, so obviously he will not follow any consistent employment. He will always say that the boss is not right here, the environment is not right here, the water cooler is not working, my chairs were not perfect, the persons whom I was working with were not perfect. But obviously always there is a cause. Okay. Then there is deception, there is manipulation, and it will always be there. Deception and manipulation for personal gain will always be there in antisocial personality disorder. Incapacity to form stable relationships. An antisocial personality disorder person can never form a stable relationship, obviously, because he has some kinds of tendencies which a normal person or a normal spouse can never take or handle lightly. Some common symptoms other than this could be repeatedly breaking the law. Obviously, you do not have any regard for the traffic rules. You do not have any regard for the conducting rules of the society. So obviously there would be a problem with that. Lying, conning, or manipulating the other people. Okay. So these people could be a con artist. These people could behave as a normal person, randomly walking into the buses and they take out some other purses or steal some other person. And this is all done just for fun. This is not done for the money purpose. Okay. Say they don't have any guilt for that, and they will not show any remorse for that. Okay. So an antisocial personality disorder person will always be defined with the help of remorse, with the help of guilt, because in this disorder the person will not have any guilt. Acting impulsively. So if they will get into a fit of anger or a fit of rage, they will act impulsively. They will break a car, or they will come onto the roads. So that would be acting impulsively. irritability and aggressiveness that leads to fighting. So always a fight that a person who is leading a fight could be ASPD. Disregarding one's own safety or the safety of others. A person suffering from antisocial personality disorder, they will never think about safety. Okay, so wearing seat belt or driving in the sea with the car, that could be possible with an antisocial personality disorder. So if a friend of yours drives you into sea, so obviously think about it that he could be suffering from ASPD. Acting irresponsibly, so they never think about things as responsibility, so they always act irresponsibly. If we see two key signs, then the first key sign would be there would be no regret, no remorse, and no guilt. Okay, as I have continually saying that the person suffering from ASPD would be having no regret, no remorse, and no guilt. And the second would be no empathy, no concern, and no care about the victims. Okay, so if you see this in a person, then always think about that this person could be suffering from ASPD. Diagnosis. Since the patient who is suffering from antisocial personality disorder will never realize that he is suffering from something like this, and he will be needing help. Sorry. So the person will never realize that he is suffering from antisocial personality disorder. Okay, so always it is necessary that the person who are living with him or her would come to the clinic and ask that he behaves as such, and could this be a disease? So that would help. In many cases, the symptoms such as anxiety, depression, arrogance, and this could be a symptom which could be diagnosed. And always family and friends may encourage them to seek medical help. Okay. In many personality disorders, which we have seen in the history also, narcissistic and histrionic also, the people never understand that they are suffering from a mental disorder. This could be a personality disorder, and they never understand that. Okay. So always this is family and friends which encourage them that you require a psychological counseling and you should go and seek a physician for this. Okay. Mostly patient with an antisocial personality disorder may not provide accurate details of its symptoms. Okay. These kinds of person do not provide accurate detail of the symptoms. So always attendants say the truth. Okay. If a person comes to your clinic and they are giving you the vague symptoms, then always cross confirm it with the attendants. Okay. They can give you a link, a connecting link, which can help him or her. Okay. Psychological evaluation of family backgrounds, thoughts, feelings, relationships, and behavior is always helpful in diagnosis. In any psychological disorder, not only being antisocial. In any psychological disorder, it is always important that we understand what is the family background from which he is coming, what are the thoughts, feelings about the society or about rules and regulations, and what is his behavior towards people, the relationship, how is he conducting the relationships, what is his behavior. Okay, the personal and medical history is always important. Is my page visible? Someone is messaging that only half portion is seen. No answer means correct. Patients with antisocial personality disorder do not sorry Antisocial personality disorder cannot be diagnosed before 18 years of age, as we have already discussed it. A person who is suffering from antisocial personality disorder cannot be diagnosed before the 18 years of age. Any person who is less than 18 years of age will only be diagnosed with conduct disorder. He or she will never be diagnosed with ASPD, whatever would be the history. Okay. So whatever he or she has done, you can never diagnose him or her with antisocial personality disorder. You can only diagnose him or her with conduct disorder. The sign and symptoms may be observed in childhood or early teenage, but you can never diagnose it with ASPD. You cannot use the tagline ASPD before 18 years of age. ASPD is diagnosed through a clinical interview with a mental health professional. The provider will also look at any documental history of disorder. So if there is any documented history of disorder that this person has behaved irrationally in his college or in his school, and has attempted a suicide or has tried to kill his classmate or has killed his cat or a dog, then that documented history could be helpful. This can always include criminal record review also. You can only be diagnosed with, obviously, if you are over 18. If you are younger, similar symptoms might be diagnosed as conduct disorder or oppositional defiant disorder. Antisocial personality disorder is extremely difficult to treat. Why? Because a person will never agree this that he requires help. Okay, and as such, same a narcissist or a histrionic person will never agree that he requires help. So only a true person, only a true physician can understand that. And being homeopath, since we have to understand the mental symptoms, it's always important to understand the mental symptoms. We always discuss about that, what is mind, what is mind. So psychology comes in handy. Okay, it always makes us understand that this is not normal and we should treat it. Now let's understand with modern treatment, what modern treatment can offer. A therapist, a psychologist will always offer a cognitive behavioral therapy. Okay, it's always a therapy which can help. Why? Because they always make it more effective. They make you learn ways to cope your emotion, ways to learn how to challenge your anger, how to challenge your hostile thoughts, how to learn pro-social strategies, and how to obtain your goals. Okay, so in this cognitive behavioral therapy, a psychologist will always provide you stimulus and make you think that you are in this kind of situation and how you will behave. Okay. And now if a person says that I will behave as such, I will kill the person or I will do this, then the psychologist make you understand that no, this is not the correct way, or this is not the correct pattern to behave, and you have to behave as such. So after few sessions, a person can understand that he might not feel that emotion, but he might understand that, he might cognize that okay, I am behaving irresponsibly and I have to behave in as such way. Okay, so therapies are always helpful. Those with high levels of anger, aggression, or depression may always benefit with psychotropic drugs, obviously. So if a person is suffering from ASPD and having a high fit of rage, high anger, then always psychotropic drugs are used. Okay, but there is a very little research on which medications helping in treating of ASPD, and FDA and US Food and Drug Administration has never approved any specific drug for antisocial personality disorder. Okay. If someone with ASPD doesn't feel any empathy or guilt at all, the only option may be try to reduce harm through therapy. Okay. So there is only an option with you is help him with the therapy. Okay. If a person is not feeling any remorse, if a person is not feeling any guilt for whatever behavior he has done, you always can help him only by the help of therapy only. The modern treatment. Obviously, we can give the medicines anacardium and pulsatilla or whatever you feel like such. We will discuss that in the later part, but obviously you will have to also psychoanalyze that. Okay, this means striving to teach the person with ASPD that it is actually in their best interest to act more responsibly, as if they have empathy. Okay, so this line basically tells you that you have to make that person understand that where he is going wrong, and always you have to try to help that person that you are going wrong here, and you have to behave in this pattern and not in that pattern. Okay, so you have to tell him the difference and make him understand that. Aggressive behavior is treatable with second generation antipsychotic drugs. Obviously, risperidone and many more are there. There is a selective serotonin reuptake inhibitors. There is sertraline. There is fluoxetine and many mood stabilizers, lithium and carbamazepine, and anticonvulsant also if there is any convulsions history. So there are many medicines which are used, but obviously these medicines are as per symptoms. If the person is suffering from convulsions, then give him some anticonvulsant. If he's suffering from some depression, then give him some mood stabilizers. If he's suffering from fit of aggression or rage, then give him some psychotropic drugs. So it is behaving as such. Okay. Now let intervene with homeopathy. Now let understand how homeopathy can help. Obviously we believe in holistic concept of disease. So if there is no local so firstly understanding the organ, obviously there is no local eruption or no external manifestation if there is no internal derangement. So obviously there is always an internal derangement of the vital force, then only a disease can appear. So homeopathic medicines are very effective in the treatment of all these kinds of diseases, and specifically mental diseases when prescribed on the basis of symptom similarities. Firstly, Since I have not seen antisocial personality disorder cases personally, I've seen a few, but obviously I cannot diagnose them with ASPD because in India it is always a taboo to diagnose some persons with ASPD or with any psychological disorder, for instance. So obviously we are going with the repertorial approach. We have taken a few symptoms. There are 9 symptoms from Kent repertory. So these rubrics have been taken, and obviously we'll use the synthesis repertory also. Then after these repertorizations, a few medicines will come, and we'll understand that medicine, that how ASPD can be understood in that medicinal context. Okay. So from Kent repertory, we have taken 9 rubrics. It is desire to murder, destructiveness, hard-hearted, hatred, impulse to kill, inhumanity, kill desire to, kill threatens, and murder desire to. Okay. So these 9 rubrics I have found in Kent repertory, which can be apt to the situation. Okay. If someone feels like that there could be another rubric which can be added in the situation, then please go ahead and write in the chat box and we can discuss in the last 10 minutes. Okay. So these 9 rubrics have been taken from the Kent repertory. These 9 rubrics have been taken from synthesis repertory. Okay. So there is abusive, adulterous, anger, antisocial, brutality, corrupt, misanthropy, rage, and estranged society from. Okay. These 9 rubrics are taken from synthesis repertory. After considering these 9 rubrics from Kent repertory and other 9 rubrics from the synthesis repertory, we come on 5 to 6 medicines. And now we would be discussing that 5 to 6 medicines from line to line. Okay. Firstly, belladonna. Obviously, when we talk about belladonna or anger issues, okay, aggressiveness or violent behavior, then obviously belladonna comes in mind the first. Okay. The first thing which comes with belladonna is anger, that a person who is very angry, who's always behaving angrily, could be a belladonna. Okay. So firstly, let's understand that Bella, that a person who has a hot red skin, a flushed face, glaring eyes, it could be. Then it is given to a person who lives in a world of his own. Obviously, ASPD persons lives in their own life and they always want to behave in a certain way. So this could be. He is engrossed in his own visions. So people suffering from ASPD also get engrossed in a vision. So yeah, belladonna comes with this line also. He has various imaginations, can see monsters, hideous faces, and various images. Okay. So this could be history of a person, that he would have been seeing monstrous faces, or he is seeing monstrous faces and he's not discussing it with the physician. Okay. So yeah, that could also be, belladonna can be helpful in that. It is given when a patient is furious and the patient bites or strike another person. Belladonna, always in a fit of rage or anger, do not understand that what he or she is doing. Okay. So in that scenario, belladonna is always helpful in ASPD, because ASPD persons do not have guilt and they do not understand that what they are doing in the fit of rage or what they are doing in anger or aggressiveness phase. Okay. So Bella can help in that phase. He has a desire to escape. A patient does not want to walk. He has sensitiveness of all senses. So Bella do not have a desire to walk. Now this is not a scenario in which that person is paralyzed and he do not wants to walk. This is in his mind that he do not wants to walk. He wants to lie down right now and he will lie down. He has a sensitiveness of all senses, and this sensitiveness means that if you raise voice, then also he can be angry. If you open a light and he wants to be in dark, then he will be angry. If you are saying something and he do not likes that, then also he can be angry. So obviously a sensitiveness of all senses. Okay. Temperature could be he could be temperature sensitive, he could be smell sensitive, he could be light sensitive, noise sensitive. So external, each and every impression sensitiveness. It is an effective medicine for controlling violent and impulsive behavior, as we are discussing right now. That in ASPD, we have a long history of violent and impulsive behavior. When a patient is strike, bite, and spit on the person's nearby with a red and hot face. So if a person in anger has a very hot and red face, glaring eyes, and behaving that he can bite or he can spit or he can do anything in anger, that could be a belladonna person. Obviously, when we think about biting or spitting, hyoscyamus also comes in mind, or hyoscyamus also comes in scenario. I think it's also in the history later on. But yeah, Bella also comes in mind. The later is anacardium. obviously, when we think about a person behaving irrationally or a person behaving not behaving as per social norms, anacardium always comes in mind. Okay, Dr. Shankaran writes in his Soul of Remedies that anacardium is a person who has always been suppressed by his family persons. His parents do not let him buy any clothes by his will, or do not let him do anything by his will, and later on that person later on that person outgrows in anacardium. Okay, so obviously the history, the history what we were talking about in the earlier slides, that comes in anacardium childhood stage. Okay, now let's talk about the symptoms. There is fixed ideas. Obviously, ASPD persons also has fixed ideas that they want to kill or they want to behave in a certain way. They have hallucinations. Anacardium persons have hallucinations that he is possessed by two persons or two wills. We all know these symptoms, that there is an angel sitting on right shoulder or a devil sitting on left shoulder and saying him to do something and saying him not to do something. Okay, so anacardium, there is always a contradiction of two wills. Dr. Shankaran explains this very finely in Soul of Remedies, that there is always two wills attended to it, and a person is trying to behave like an angel or a devil. So you can understand this better with Soul of Remedies also if we are reading that. Then there is anxiety when walking or as if pursued. This person is always behaving non-irresponsibly. This person is always thinking that someone is pursuing him from behind. Okay. Then there is profound melancholy. There is hypochondriasis, and there is tendency to use violent language. Obviously, this is anacardium. He will behave violently. He will have violent language. Okay, but always there is a symptom which anacardium always comes into the mind is brain fag, impaired memory, absent mindedness. Okay, so anacardium, there is always two poles apart symptoms. One is that he can behave irrationally, he can behave angrily, and then there is second symptom that he do not remembers anything. His memory is very impaired, his memory is weak. So these two symptoms always comes into anacardium, and this always makes up the mind. Then there is lack of confidence in himself or others. This person is malicious, seems bent on wickedness. Clairaudient, clairaudient, that is hear voices far away. That could be dead people, that could be alive people, but he's clairaudient. Absence of all moral restraint, as we have been talking about ASPD, that this person has been have been absence of all moral restraint. And then there is irascible desire to swear and curse. A person suffering from ASPD can have a desire to swear and curse. They do not have any moral restraint. They can be wicked, and they can be angry and have a fit of rage. So obviously these symptoms can comes in the mind when we talk about anacardium. Hyoscyamus niger. Obviously, when we are talking about Bella, then we discuss that a person is spitting or a person biting can be hyoscyamus niger, and obviously this mind came, this medicine came again. So there is lack of inhibition or morality. Then there is lewd talk, cursing, promiscuousness, exhibitionism, masturbation. So hyoscyamus is all about behaving antisocially. Hyoscyamus is all about not behaving as per the social norms, not behaving as per the society, not behaving as per the rules and regulations. Okay, so obviously hyoscyamus nigers come into this repertorization sheet. Lack of inhibition, lack of morality, lewd talks, cursing, promiscuousness, exhibition, and masturbation. Enjoy shocking others. So it could be starting as funny or a jesting way, that he pulls the chair, or he can do pranks, but he will not feel the guilt if someone is hurt from that prank. Okay, so that takes him into the clause of ASPD, that this person will have no remorse or will have no guilt. Poor impulse control. Obviously, even ASPD have a poor impulse control. Then there is silly, annoying behavior in which they get pleasure from deliberately irritating or upsetting others. Okay, so obviously there is a victim who has been irritated, or who is getting upset time and time again, but this person do not have any remorse for that. Okay, so that is hyoscyamus niger for you. They act out for the effect it produces, even to the point of trying to shock by publicly removing their clothes or engaging in precocious sexual behavior. So hyoscyamus can behave as a precocious sexual behavior, or can remove your clothes in a name of prank. So Hayos, for in regard of their laughing or in regard of their silly behavior, can behave in any which way, and you cannot make him feel any remorse or guilt about it. The symptoms of those needing Hayos are often worsened by touch or heightened emotions from disappointed love, jealousy, or fright. Okay. So if you touch a Hayos person, or if you want to make a Hayos person feel love or feel fright, then obviously that is problematic. Okay. He can't feel that. He will be restless. He often feel hot, and many experience tics, jerks, or spasms. Okay. Next is Staphylococcus. Obviously, when we think about ASPD, Staphylococcus do not comes in mind. Okay, but these rubrics covers that Staphylococcus. Okay, a person suffering from sudden burst of anger. Homeopathic medicine Staphylococcus is a prescription for that. Okay, if a person is suffering from sudden burst of anger, obviously because we have learned that ailment from vexation, ailment from anger, then there is a Staphylococcus in it. Such person will have a tendency to suppress anger, but will be given into sudden fits of rage during which they are likely to throw or break things. Okay. So obviously they have been suppressing anger from a longer time. If you talk about Staphylococcus, not talking about SPD, a person of Staphylococcus, when we read about it in a course of line, then obviously we understand that there is a person in Staphylococcus who is trying to suppress his emotions from a very longer time. He is vexed from a lot of things, and when he's trying to suppress anger from his best core, and when that comes out, when that anger comes out, then it is in a sudden fit of rage, and during which they can throw things, they can break things, they can curse you, they can bully you, they can do anything in that fit or rage of anger. Okay. And then they will justify it from their past, that since in my past I have been behaved like this, and it has been justified, that now what I am been doing is also fine, and you cannot blame me for that. Okay. Then there is poor self-confidence, there is self-pity, there is reproaching oneself, getting offended easily, and feelings of worthlessness are seen. And now this line is always this is the line which puts uh, Staphylococcus in narcissistic personality disorder or histrionic personality disorder. That is why we have read Staphylococcus and histrionic personality disorder also, because this person is having a poor self confidence, is having self pity, and is reproaching himself only, and is getting offended easily. If we read the case analysis, then obviously a person suffering from ASPD or Staphylococcus will have a history of sort of humiliation, guilt, physical or sexual abuse. And talking about physical or sexual abuse, guilt or humiliation, we again come to our etiology, that ASPD also have a history of the same. Okay, so this was our last slide. These are the medicines. These have been the repertorial sheets, and we have the last 15 minutes left. Okay, so it ended before time, and this ended our slide. Thank you very much. And if we have any question, then please go ahead.
Very good and excellent session once again from Dr. Manish. This is something great because personality disorders you have mentioned here. You have made all your presentation about various personality disorders, and this is something great as far as homeopathy is concerned. This kind of studies and this kind of presentations are really needed, and it will do very good for our coming generations to watch it again and again and understand what is what and what is the proposal homeopathy can do for these conditions. Some of the cases need to be presented by some of the experienced person about the same. And I think a lot of homeopathic research work is going on by our National Research Institute, where they can publish all those things. Of course, they may be publishing all those things in their website. And if somebody interested in these cases, may go there and watch all those cases also. Anyway, congratulations, Dr. Manish. Dr. Neha Kakkar is ready to interact with you. And those who want to interact with Dr. Manish can raise your hand so that we will allow you to unmute yourself and can directly speak to Dr. Manish. And it is over to Dr. Neha, to begin the session.
Yes. A very wonderful and excellent session by Dr. Manish. I would like to congratulate him on this. He very well explained the stepwise, everything like etiology and what are the factors which can lead to the development of antisocial personalities, and how it is very difficult to diagnose sometimes. And yes, it is very difficult to get these cases because they don't themselves recognize the fact that they are suffering from some problem, or many times the family members will be coming up with the complaints that they are showing aggressive behavior or antisocial behavior or behavior which is not acceptable by the society, and then also they don't come to the clinic for these conditions. We have to lure them for some other physical condition they might be having. And also, in cases where people are suffering from chronic alcoholism or chronic alcohol addiction, these people also I guess fall into this category, and it's very difficult to get them the medicine inside into them, because they don't accept that they are having problem, or sometimes they don't want to leave the addiction because it's like a support system for them. So it's very difficult to convince them that you need some help, or because they pose a very much a menace to the family and to the society, their behavior, but they don't recognize themselves this fact. So but the overall presentation of the whatever the presentation Dr. Manish gave, it was very much excellent and very good, and it was very enlightening. And we also knew about the different medicines. Obviously, if we get a case like this, homeopathy can play a very major role because of the mental symptoms covered in these medicines. So congratulations, Dr. Manish. A very nice
Thank you,
session.
ma'am. Thank you, Dr. Neha. And
Yeah.
obviously, I'll try to explain a case which I took in my MD years. And there was
Okay.
this lady which came to me in my MDs, and she was talking about she had some issues with migraine or something. And
Okay.
when she came into my clinic, then she has some marks on her hand on her neck. Okay, and
Okay.
I think I have seen some patients like this in Patna. My MD was in Patna only. So I have
Okay.
seen some cases like this in Patna, and it was very common. And I talked to her about that how you got these marks, and she was not ready to talk about it. But
Yes.
since we
The
want to
only, yeah, that is the only issue here, because these patients don't accept the fact that they're having some problem. That is a very difficult part of these cases. Yes.
obviously, and then
Yes.
when we try to when we try to counsel them, or when we try to help them that what you are suffering is not your mistake and is someone else's, then they
Yeah.
only say that no, it was my fault, I did that wrong and I did that wrong. And when I told her that let your husband come here, and I can help him and I'll try to help him, and he never came into my OPD. He never came that I have done this, or I have done that, and he
Yes.
never came to
Yeah.
my
There
OPD.
is a lot of,
But the women,
yeah.
yeah, but the wife was Stephi Segri. I gave her that on the basis of being vexed, and so
Okay.
she get well. But obviously the domestic violence, I don't know how well that was going on.
Okay. Okay. Yeah.
Hmm.
But we, yes, homeopathy can definitely help in these cases
Yeah,
very well, because we have a number of medicines for these conditions of aggressiveness or suppressed emotions, or
yeah,
these self-destructive behavior or homicidal behavior. All those things are covered in the materia medica and repertories very well.
yeah.
Yes.
Eh,
So
Exactly. We need to bring the patient's family or patient bystander to get the right cause of the illness. And of course, we know that the for right cause of the illness may be this kind of mortification or this kind of aggression from the part of the husband or from the family members. That may be the reason. But unfortunately, nowadays the things are we are getting we are noticing lot of changes among our young generation women, because they come up and say they are ready to share the truth, that what is how it happens, when it happens, and why this happens. But as you know, the melancholy personalities, they suffer. They won't come up and say that, though, doctor, I have this problem from my husband. They may have tried of divorce. They may have tried of running away from the family. So they are really sufferers. They are suppressing the feeling. They are suppressing the emotion. That's the reason why the staff is coming to the picture here. And they in the meantime, the husband can also be given the same remedy, and because of suppression, the women can also be given the same remedy. That is the peculiarity of our homeopathy, and homeopathic doctors can really save all these kind of patients if they open up their mind and come out and give the best usually sometimes we may not get the right remedy right in the very best thing first consultation, because the patient may not open up, but when they go back, or when they are while taking the medicine, when they are about to move out of the clinic, they may stand up and say, "The doctor, I want to say something more to you personally. I shall call you, or I shall give you a chance." In some situation, some of the closest family member may be there, so she cannot reveal what is happened in front of the doctor. But when we get an opportunity to note what is happening here, when she is coming personally, or directly to us, or in those conditions, we can ask the patient to write up a thing and bring, or you can call me at this time, and you can say something if you want to say like that. That will help us to save the patient, rather than we can win over the patient. What's your opinion on that, Dr. Manish?
Obviously, sir, we always have to talk with the patient for that. And if he is not ready, then we have there comes a time when we also understand that the patient is not ready to share this. Then we have to tell the attendant that go out, and we want to talk the patient in our personal space. And then only comes a time then the patient gets broken down, and then he or she gives some of the symptoms, some of the context which could be helpful for us, which could help us in diagnosing a few certain psychological diseases which could be responsible for his or her suffering. And this is very important, and that's what the natural beauty of homeopathic case taking, that we have to go with each and everything, even may it be mind or may it be body. So obviously, yes, sir, really, that's the story.
Yes, now I invite Dr. Rebadavi Ambadi to say a few words on this presentation. Ambadi, madam, are you there? If possible, you may respond. Dr. Bobley, do you want to say anything? And Dr. Veena, you can also say, because you're Dr. Veena,
Hello,
yes, madam.
Ganesh. Yeah,
Yes.
it was very nice presentation. And see, nowadays it is very prevalent. No, the situation is like that. So we can very well use all these medicines, and whatever he told, that anacardium, belladonna, hyoscyamus, and all suits to the people, that antisocial people nowadays. Very, very nice presentation. Thank you a lot. Please come
Thank you, ma'am.
again
Thank you.
with another subject. It was
Thank you,
very
ma'am.
nice. Thank you.
Thank you, ma'am. Thank you.
Is there anyone who want to communicate with Dr. Manish? I think Dr. Ramparesha sir is there waiting for you. Sir, come out.
Thank you, everyone. Good evening. And thank you, Dr. Manish. Congratulations. Very nice, excellent presentation of
Thank you, sir.
personality disorder. Very kinds of personality disorder and deals very role of homeopathic medicine in Acadium, Hyoscyamus, Belladonna. Actually, very beautiful homeopathy. Thank you. Very, very thanks.
Thank you, sir.
Yes, we have Dr. Manish have discussed about different personality disorders, and that is the beauty of his presentations, because these are the things people used to avoid, because these are the things which are very, very tough to handle. Of course, we as homeopaths has to do such presentations in a powerful way, and he has done 100% justice to his presentation.
Forgetful.
Dr. Boblin, are you there? Please note and say your statement on this presentation. Dr. Boblin, you can unmute yourself and speak. If you are there, you can say vote of thanks to this session also. Not responding. So I think once again I invite Dr. Neha Kakkar to say vote of thanks to Dr. Manish. Yes. Is there any network problem?
Am I audible, sir?
Yes, no.
Yes, ma'am.
Okay. So it was a very wonderful session from Dr. Manish, and it was a pleasure to hear him on this topic. And we hope that in future sessions he can also, bring up some good cases on the personality disorders. The different personality disorders which we have, like schizophrenia or OCDs or bipolar disorders, depression, and etc. And we can get much more insights and knowledge from these cases, and how and it's a beauty to see how homeopathy works wonderfully in these cases, especially the potencies like the 1m potencies or the 10m and the higher, even 50 millisimal potencies. So I guess case presentations will also be a very good session from him. We will like to have, and we will be love to see him talking again on other different topics also. So thank you so much, Dr. Manish, for your wonderful time and knowledge sharing. Hope to see you again. Thank you so much.
Ma'am. Thank you very much.
Thank you, Dr. Neha Kakkar. And tomorrow we will have a session from Dr. M. Prakash Rao, who was a former research personality from CCRH, and we'll be talking about what is cure and what curative. That is tomorrow. That will be the second part of the same. Dr. Manish has done a wonderful presentation in this forum, in this evening, and we are very happy to listen to him. And we are all thankful to you. And with that, we come to the end of the day, 1297. Thank you all, and good night. See you again tomorrow, same time. It's over to Dr. Mariama John to moderate the Malayalam.